Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with bilateral, fully occluding plugs of earwax. These plugs were quite hard and solid, and therefore the patient did use some medical grade olive oil spray prior to attending. Now, although the olive oil didn't soften and penetrate the deeper section of the plug, so the core itself remained hard and solid, it did soften the surface of these wax plugs, which then enabled me to get a slightly better suction grip. Sometimes with really dry, hardened wax, it's difficult to obtain an airtight seal with the suction tip. But when it's slightly softened, the suction tip tends to just embed itself better onto the surface of the plug, thus creating more of an airtight seal, which will then increase suction power. I typically don't advise my patients to use drops, just simply for the reason to avoid the risk of them over oiling their ear. So if you put too much drops in your ears, it can turn the wax into almost a liquid molten consistency, which is much more difficult to then remove. So if I need to use drops, I typically apply it during the procedure itself. Now, you will see both eardrums, so this is the left ear to begin with, they have a condition called sclerosis, and that's calcification of the eardrums, essentially scar tissue, so buildup of calcium deposits in the middle layer of the eardrum. So your eardrum is 3-ply thick. The outermost layer of the eardrum is lined with the same skin that lines the inner 2/3 of the ear canal, the epithelial skin. You then have the inner layer of skin, which is lined with the mucosal skin that also lines the middle ear. And then sandwiched in between is the fibrous connective tissue layer of the eardrum. And the reason why this patient's got sclerosis is that as a child they had grommets fitted. So grommets are a ventilation tube to allow air to ventilate and enter the middle ear. And grommets are typically fitted when a patient has a blocked eustachian tube. Normally the middle ear, the cavity behind the eardrum, is ventilated via the eustachian tube, which is a narrow orifice that connects the back of the nose, the nasopharynx, to the back of the eardrum. But if that tube becomes blocked and doesn't open when it should, it prevents air from aerating the middle ear, and it creates a negative middle ear pressure. And as such, your eardrum is cupped inwards. There's like a vacuum effect, a suction cupping effect. Now, when you have grommets fitted, sometimes patients can develop sclerosis, so scar tissue. In the left ear, they had it anteriorly to the front portion of the eardrum and posteriorly to the back part of the eardrum. In this their right ear, they've got it in the anterior inferior recess quadrant. There's a bit of residual wax that's lining the medial part of the ear canal, but we're going to leave that. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.